So please join me in welcoming Dr. Jeffrey Albaugh. Dr. Jeffrey Albaugh is a board certified advanced practice urology clinical nurse specialist, researcher, and author based in Chicago with over 30 years of experience caring for individuals with sexual dysfunction. He is also a certified sexuality counselor, has his own clinic at the Jesse Brown VA Medical Center, serving veterans, and helps lead our Zero support group at Gilda's Club in Chicago. So let's give Jeff a warm welcome. So excited to have you here, Jeff.
Thank you. Thank you so much. And it's so great always to work with you, Terry. So thank you so much for allowing me to share my expertise. And thank you to all of you. I'm so glad you're here. And I really appreciate that you took time to learn more about this subject. And I think this is one of the most important subjects that is out there. That's for sure. I think two things that are really important is self-care, taking care of yourself, and because you can't take care of anybody if you don't take care of yourself. That's not selfish. Self-care is what helps us and enables us to be able to love and care more for the people around us. And then second to self-care is care of, and nurturing of your loving relationships. And so we're going to talk about that today. We're going to talk about improving relationships and intimacy after prostate cancer. So let's get started. All right, I'm going to hit that advance again, maybe. The slides are not advancing, but let's see. Hold on a second. There. Oh, there we go. Now we're actually in it. There's my slides. Okay, now they'll advance. So anyway, thank you so much again for joining us, and let's get started. As she said, I do work at the Jesse Brown VA Medical Center. I worked in the private sector for many years at Northwestern as well as at North Shore Endeavor Healthcare, but I have retired from there because I'm older now, and I do other things now like my podcast and things like that, where I can educate a broader audience than just in my clinic and things like this as well. So I'm really excited to be here with you today, and I hope you learn a lot. All right, so we are working on improving relationships. Let me see if my slides will forward now. Nope, not forwarding. Let's see. Let me see if there's a button anywhere else. Nope. I'm not sure. Okay. Does that mean I'm forwarding, hopefully, or if they are? Let me just check and see real quick. I'll hit it again. So nope, they're forwarding for me, which is fine. All right, so let's get started. And then I'll try to forward. If it doesn't, then I'll ask them to forward, because for whatever reason, it is not forwarding on my advanced slide button. Let me see if it forwards that way. Nope. Okay. All right. So do we need connection with others? Why is this so important? Why are we here to talk about this? Because guess what? We are all hardwired for connection to others. It's not optional. You might think, I don't need anybody, I don't need anything, but that's not true. We have to have others in our lives. And Daniel Goleman, you might know him from a book he wrote. If you've ever heard of emotional intelligence, Daniel Goleman wrote a whole book on that and pulled together all the research and did a book on it. But he wrote a second book called Social Intelligence that showed all the research that says you, me, both of us, we are hardwired for connection to other human beings. It's not optional. It has to be. Do you know what happens to babies if they do not connect to another human being or bond? They die. They call it failure to thrive. It's a sad situation, but if a baby doesn't bond to another human, they will literally die. So we are hardwired for connection to others. I'm going to come, and then also, if you ever learned, Abraham Maslow wrote the amazing hierarchy of human needs, and one of our essential human needs, not like self-actualization and a higher need, but a basic need is love and belonging. So we all need love and belonging. But All these things make us vulnerable, and vulnerability is scary. So we shield ourselves from hurtful emotions. And that's from the work of Brene Brown. We shield ourselves by doing all kinds of things. Sometimes we throw ourselves into our jobs. Sometimes we shop more than we should, gamble, alcohol, lots of different ways that people shield themselves. They isolate themselves and shield themselves. So that can definitely be a hindrance to connectivity, which is essential for all of us with other human beings. Let's take just a moment. I'm going to take a second before we go to the next slide and do a little bit of a centering exercise. I wanted to begin towards the beginning with this. We've introduced the topic, but let's do a centering exercise to prepare ourselves because this is a lot of information and I really want you to hopefully get exactly what you need out of this today. That's my hope and prayer for you. So why don't you do this for me? Make yourself comfortable. Make yourself comfortable there in your chair, wherever you are. Put your feet flat on the ground. Ensure that your back is straight but relaxed, and rest your arms gently in your lap or on your armrests. Close your eyes softly if you are comfortable doing so, and begin by taking slow, deep breaths in through your nose over 3 to 4 counts, and then exhale slowly over 4 to 5 counts. Continue that breathing pattern. Slow, deep breath in from the diaphragm, 3 to 4 counts in, followed by a slow, deep breath out, 4 to 5 counts out. Gently exhale in your nose, out your mouth if you're comfortable, whatever way is comfortable. As you continue to breathe deeply, scan your body for any areas of tension. With every exhale, imagine releasing that tension. Feel a wave of relaxation wash over you. Let your shoulders drop. Let them drop. Unclench your jaw. Soften any tight muscles. Bring your focus to this present moment, to right now. Repeat to yourself, either silently or loud, I release any worries or concerns that I am carrying. I release any worries or concerns that I am carrying. I am fully present in this moment to learn and understand. Allow these words to resonate deeply within you, setting a calm and focused intention. Take 2 more slow, deep breaths through your nose and out your mouth. As you exhale slowly through your mouth, feel yourself become more grounded and centered. With each breath, feel confidence and readiness building within you. Trust that you are fully prepared for whatever lies ahead. And when you feel ready, gently open your eyes. Bring your awareness back into the room and to where you're looking at the presentation. Carry this sense of calm and presence with you as we continue this journey of learning more about relationships and intimacy after prostate cancer. All right. Oh, I'm advancing now. Yay. All right. So what is sexuality and intimacy? What is it and why are we talking about it? So sexuality is intrinsic. You're born with certain features of sexuality, but it's multidimensional. There's lots of different facets to it. It's dynamic. What you believe sexuality to be when you're 4 or 8 or 14 or 24 or 48 or 78 may be very different. It's individually understood, but it's also culturally defined. What they believe sexuality is, things that they believe about sexuality, norms of sexuality in a culture like China may be very different from a culture like the United States. The culture were brought up in the United States may be very different from the culture that someone else was brought up, and that impacts how you view sexuality. But it's a collective characteristic related to sex and love, and it's a sense, or some people think of sexuality as that sense of male or female or non-binary, neither male nor female. All are welcome here today, by the way, no matter your gender orientation, your gender identity, your relationship style, you are so welcome here today. So what's sex? Sex is genital and body stimulation for pleasure. It may include oral stimulation, manual stimulation, or vibratory stimulation, and or intercourse or penetration, but not just intercourse or penetration, all those other things. If it involves pleasure and genitals, that's what we define as sex for this talk. Everyone's different. So sexual needs vary from person to person. What one person needs may be very different than another. But in general, that are some of the definitions. Now let's talk a little bit about intimacy, which is my next slide. And intimacy refers to a deep and meaningful connection characterized by emotional closeness, trust, and mutual understanding, where you feel truly known, accepted, and valued. So you feel acknowledged, known. So that deep, meaningful connection characterized by emotional closeness, that's feeling emotionally close to them, having trust that you can confide in that person, and mutual understanding that you're able to communicate and understand each other on a deep level, and that you feel acknowledged and known. So important. Now, Hatfield said it was the process by which two people attempt to meet towards complete communication on all levels. So that means nonverbal, verbal, all levels of communication. So here's a question for you. You got a couple who's fighting, and couples fight. Fighting, disagreements will happen because we all have different ways of seeing things. Hopefully you're fighting fair and having productive fights, but fights aren't always fair. But so this couple is not speaking to each other. So can they have intimacy? According to Hatfield, no. How can you have complete communication on all levels when you're not communicating on a verbal level at all? But could they have sex? Yes, couples do have sex, even when they're not speaking to each other. It's absolutely true. So you could have sex, but not intimacy. Sex and intimacy work hand in hand, but they're two distinct concepts. And intimacy is something that people hunger and long for with all their heart and soul. In fact, a lot of people believe it's one of the things people so desperately want, to feel acknowledged, heard, and seen by another and not judged. But we're scared to death of it. We're scared to death of it because it makes us vulnerable. So, how do we improve intimacy or connectedness? I don't know about you, but I think, wow, I want more of that, to feel connection, like Brene Brown says, to feel seen, heard, and valued and not judged by another. Who doesn't want to feel seen, heard, and acknowledged? I do. And I'm guessing all of you do too, because it seems like when they've looked at research, everyone sort of needs that intimacy and connectedness. So, but in a loving relationship, we want to make sure we're connecting emotionally. We want to that takes time. It takes energy. You have to put work into it. So you have to show genuine interest. When your partner walks into the room, does your face light up? Does it lighten your day up when they enter into your life, or you think about having time or spending time with them? So genuine interest in your partner, and really communication on your needs, and communicating it in a loving way, a kind way. Communication can be really tricky. So lots to work on there in relationships, but that could be a whole nother talk. You want to increase physical touch, physical affection, physical ways. We're not talking about sex. We're just talking about, I touch my hand to the small of your back, or I come up behind and hug you, or I hug or give you a hug or a kiss goodbye. But physical ways of saying, I love you. It's one of the love languages, physical touch. Everybody, if you've never become familiar with the 5 love languages, physical touch is an important one. All of them are important. And there are different ways that we express love to each other. So we want to increase intimate communication. So beyond just, hey, did you pick up the kids, and logistical things. And so we want to work on good, positive communication and problem solving things to resolve conflict and to connect deeply with each other. So talking about shared dreams and meaning and important things, that's really what intimate communication can be about. My one couple's, I love, they called it their pillow talk. They would have pillow talk. My wife and I do some of that sometimes. Sometimes we get up, we do a bunch of stuff, and then we leave the bed unmade for a little while and we just get back in there and chat sometimes. You can do that too in there, and it can be really wonderful and really nice. So pillow talk, I like that. One of my patients, my couples came up with that. Show appreciation, acknowledge. Everyone wants to feel acknowledged and appreciated by their partner, especially by the one they love. You have to be vulnerable. Vulnerability, we're going to talk about more, but it's the only path to love. It's the only path to creativity. But it also means when you're vulnerable, you can get hurt, and you're going to feel all emotions. Sometimes you're going to feel sad. You're going to struggle with some things. You want to try something new. Trying new novel things builds up dopamine, and dopamine is one of the cuddle neurotransmitters. And so it helps us want to bond more with that special person. So trying something new or exciting. Make sex a priority, sex and intimacy. If as busy as we all are today, if you don't make it a priority, guess what? It's probably not going to happen. And it doesn't happen. Sometimes you got to put it on your to-do list to make sure it happens, because you have to invest time and energy into relationships. They don't just happen. You have to put work into them. Use the right love language. And I talked about that earlier, the 5 love languages, and you can find that. You can do a test online. You can find out a little bit more about your love language. Your partner can do one and find out about their love language. But what is sometimes you'll want to use your love language to communicate with your partner, but you also need to become really familiar with your partner's dominant love language and all the love languages and ways of expressing love. More love's a great thing. And then have fun together. Have fun. Again, builds dopamine, can be a wonderful thing. All right. So that's a little bit about intimacy, and we'll talk more about that connection and improving that, but it's so, so important. And this is the sexual response cycle from Masters and Johnson. Masters and Johnson did amazing research that we'll probably never be able to do again. I mean, they literally paid people to have sex and masturbate in front of them. Nowadays, that would be something the institution review boards would never let you do because of the sensitivity of all that. But they did, and we learned so much from their research. So they say it starts with desire, excitement. So this desire, this push towards intimacy and sex comes. That's the excitement, and it sort of builds. Your tactile sensations increase. Your heart rate increases. Your blood pressure increases a little, and so that excitement builds. And we don't want that to build forever. It plateaus and it feels wonderful. All the sensations feel good. Everything feels so good and so wonderful. And a lot of people like to hang out in that plateau part of the response cycle. And then orgasm occurs and resolution. Now, you might see a little problem here. The average, just start to finish without controlling it, for a male is 2.8 minutes, and for a female, 13 minutes. That's about a 4 times difference between the male and female start to finish from excitement to resolution. Females may be multi-orgasmic, and this is a little bit of how that cycle looks in this next slide. Yes, so you see, and if you follow along there, you'll see desire. That's the excitement. It builds arousal. The genitals, the vagina moistens and deepens and readies for penetration, the genitals become engorged, the clitoris, the penis become full of blood. All those things happen leading up to plateau where everything feels really good, and then orgasm. This would be the female with the multi-orgasm, and then resolution. So that's the Masters and Johnson model. It's sort of a linear model, and it's a good model. But when Rosemary Bassan, in this next model that you'll see in my next slide, went to do her research, she took Masters and Johnson's amazing work, and with her women, she applied that last model that you saw, and she found that over a third of the people, now this is a researcher's nightmare, over a third of the people in her study said, oh, wait a minute, it doesn't start with excitement or desire for me. That's not what gets me going. For the women in her study, and I think many women and men, it may start with emotional intimacy, connection, that connection. I want to feel heard, seen, and valued. I want us to connect deeply. And that emotional intimacy connection motivates a neutral person, in this case, a woman in her study, to find and be more responsive. This is nice. I want to move closer to you physically. I want to touch you, maybe kiss you. And then that's the sexual stimulation, genital stimulation, then arousal. And way over on the other side, we see desire finally come into the model. So I think this is an excellent model. And I do believe that as busy as we are, all the things going on in our lives, that oftentimes it doesn't start with this drive, this desire, this excitement. It starts with emotional intimacy. It starts with engagement with each other. That's why I was speaking about intimacy in the beginning. It's so, so important. But anyway, so you can see how this is circular and it goes round and round. That desire builds, and then, oh, this feels really good. And then closer connection or emotional intimacy, and it's circular in nature. I like both models. I use features of both models as I work with patients, and I think most people fit into one or the other model, and I'm glad we have both. So that's the sexual response cycle for humans. All right, next slide. So here today, we're here because we're talking about after prostate cancer treatment. Well, prostate cancer treatments are surgery, whether it's open or robotic, or radiation, whether it's seeds or external beam or proton beam, or androgen deprivation therapy, which is hormone depleting therapy, or chemotherapy, or active surveillance. So we're here talking about those things. Why are we talking about sex and intimacy at this prostate cancer conference? Because these next couple slides that I'm going to quickly go through to remind you that, yes, radical prostatectomy, in both these sides, you can see with radical prostatectomy, let's go back to the previous slide for just a second. With radical backwards. There we go. Perfect. Radical prostatectomy. So you can see in these studies, now these studies were done years apart, but in both studies, most men, about 78% at 24 months and 72% at 5 years after treatment, reported problems with erectile function. And here's a whole different study, and study after study has shown this. When they ask the patients directly, about 8 out of 10 men are struggling with erectile dysfunction after prostatectomy. Not to mention that when your prostate's gone, you don't ejaculate when you climax fluid. The fluid's gone with your prostate. So that's a change as well. What about radiation therapy patients? Our next slide shows that just as many of those patients, also 81% of men, you see these numbers are over and over. You see radiation therapy or surgery, that the number one negative outcome is sexual dysfunction, erectile dysfunction, things of this sort, because the prostate's part of the sexual reproductive system. Now, when people have radiation therapy, this is where they get confused. Some people, because the studies show it's not always as severe with radiation therapy, but just as many men will report problems with sexual function after surgery or radiation, either one, but it's not always as severe after radiation therapy. And that's where people get confused, because it comes on slower because the radiation is cumulative in its effect. And so it usually happens towards the end or within 3 to 6 or 12 months afterwards. But when we look 2 years after surgery or radiation, just as many men, whether they had surgery or radiation in whatever form, report problems with sexual function. So the number one negative long-term complaint after surgery or radiation or androgen deprivation therapy is with sexual dysfunction and erectile dysfunction side effects. And we'll talk more about that in a minute. Let's go to the next slide. And what about so prostate cancer, it can often be dependent on testosterone. So if we use medications to decrease testosterone to nullify it or decrease it to virtually nothing or nothing, that in the old days, they used to remove your testicles to do that, but they don't have to do that now. They can do that with many and various medications we have available to do that. But now that can affect your sex drive because testosterone gives you your sex drive. It helps with concentration. It works all over your body. So it can have side effects, and you can see the side effects there. But one of the main side effects, again, is erectile dysfunction and sexual desire, loss of sexual desire. Sometimes even climax can change. So many sexual side effects to androgen deprivation therapy, in addition to sometimes hot and cold flashes, but some men tolerate it well. We do a lot of things to try to help men be able to get through those treatments as well. But now we're seeing, gosh, whatever treatment you do, the main side effects are sexual side effects. And that's why I'm here today talking to you about this. No doubt about it. So let's go to the next slide. And we find that how does prostate cancer treatment impact sexual function? The number one side effect that you've just heard over and over, whether you have your prostate removed with surgery, whether you have radiation or hormone ablation therapy, is erectile dysfunction. Ejaculation does not typically occur after prostate removal and also after radiation because the prostate is where the fluid that comes out with ejaculation, it all ends up in the prostate right before it's propelled out. And the prostate it has a major role in ejaculation. When I talk about ejaculation, I mean the fluid coming out, not the sensation of orgasm, the good sensation of orgasm climax. That remains, but the ejaculation itself is gone with your prostate. Now, does the sensation still feel really good? Well, about equal amounts of men say it's diminished. That's one of the most common things is they say it's different, it's diminished. It's still there, and men are thankful it's still there, but it's often described as different or diminished. Or about an equal amount of men, almost not quite, say it's similar. It doesn't seem that different to me. Even though the fluid doesn't come out, it doesn't seem that different. But just as many men say it definitely feels different, and it may not be as pleasurable as it was. A small percentage of men, between about 5 and 10%, have a more intense climax. And in my study, as well as other studies, I met those men, and it is definitely true. Even their partners were like, no, the climax was never that intense before. Now, do we wish everyone had a more intense climax after surgery or radiation or whatever? Yes. But most men say it's different or diminished because there's no ejaculate fluid, and even the sensation may be different or diminished, or it's similar, but a small amount of men have a more intense climax afterwards. So it's different. The penis may seem to kind of disappear up into the body. And there's a lot of reasons for that. Men complained about it for a long time, and in research, they discovered, yes, there is truth to that. Lack of erections can cause, not severe, but muscle atrophy. Think about if you didn't use your arm or hands or legs, those muscles would shrink or atrophy, some more than others. And in the penis, it's not usually a significant amount. It's usually on about 1 to 2 centimeters, which equates to an inch or less difference. But some men really notice it. Some men don't notice it. Most men do talk about it though, and I think do experience it. So they call it penile shrinkage. In the beginning, it's because increased muscle tone after surgery, because the muscles just sort of tighten up, or sometimes after radiation as well. But eventually that will relax back. But then it can be from lack of blood flow causing erections, leading to changes in structures and muscle atrophy. We can talk more about it if you have questions, but I want to get to everything. So all these factors can affect men, their partners, and quality of life in individuals who have had prostate cancer. We're going to go to the next slide, and so what can we do about it? That's the important thing. Well, of course, there's behavioral therapy and counseling. I always like for my patients to come in. If you have a partner, I love for people to bring their partner in because you're both affected by it and we want you both to understand it. I'm so proud of you if your partner is sitting beside you or your partner is listening or you're a partner listening to this today because everybody is affected by this, your partner and you. So we try to do this work together. Even when you just come in for your consultation about the erectile dysfunction, that medical visit, it's still very helpful to have your partner there to learn right alongside you and to have that support. We have all kinds of things out there. I'm not going to spend a lot of time on each, but I'm going to touch on them briefly. But we have vacuum devices. We have pharmacological agents. We have pills. We have shots. There is an over-the-counter topical thing now too. There is surgery, the penile implant surgery, and I can talk more about those at the end, but I want to leave time for your questions and focus in on what you want me to talk about after I finish talking about a few more things. So we will go to the next slide. And I think it's so important to expand your thinking about intimacy and sex. We are programmed to believe that sex leads to, even with, if you learn the bases when you're growing up, first base, second base, third base, where do you end up? What's home plate? Penetration or intercourse. But it is not the only way to have pleasure, orgasms, and connectedness. There's many, many ways to experience sexual pleasure. So don't limit yourself. The only thing you can't do without a hard enough erection is intercourse or penetration. But female partners don't necessarily need a hard penis for pleasure. The clitoris and penis contain the same, inside they contain very similar structures, erectile structures that become engorged with blood. And most pleasure comes from the clitoris in the woman and the penis in the man. If you want to see something really interesting, I love Google. You can go to Google Images and you can look at side-by-side comparisons of the structures of the penis and the clitoris, and you will see that they are very, very similar. And that's why they are the main source, not the only, but the main source of pleasure for women or people who have a clitoris, or men or people who have a penis. They are the main sources of pleasure, not the only source, but the main source. But manual stimulation of the penis or clitoris, oral stimulation, vibration, rubbing clitoris and penis together, rubbing clitoris and clitoris together, penis and penis together, manual, oral, vibratory stimulation, all these things can lead to pleasure, orgasm, and connectedness. The excitement comes from the anticipation. What will we do this time? It doesn't always have to be, I touch you here, I touch you there, we do this, then you have an orgasm, I have an orgasm, everybody feels good, we're done. It can be so, so, so much more than that. And the excitement builds from the mystery of what will it be this time? Intimacy is so important. Connectedness, feeling seen, heard, and valued. On the next slide, I would like to talk just a little bit about the importance of relationships. We all need connection. Life is really hard, and having someone who truly sees you, knows you, and values you, whether that's an intimate, loving partner. I have other people in my life. You know, you also will have not sexually intimate, but you'll have intimate, deep, connected relationships with other people, friends, family members, parents. Connectedness, that intimacy can happen not in a sexual way with other people. And intimacy is a wonderful thing because it means connection and feeling seen, heard, and valued by the others. Life's hard. If you live long enough, it's going to be hard and stuff's going to roll your way. And we all really need each other. We need reciprocal help, leaning on each other. Can we accept and adapt to the idea that there's more than one reality? No, no, no. My truth is the truth. You're wrong. But if you're that wrong, if I'm that right, that means you're that wrong. We have to learn that there's two realities. My wife and I, she's a detail person. I'm a big picture person. We'll walk out of the same room sometimes and be like, we'll start talking, and it's like, were we in the same room? Because that is not anything of what I picked up of what happened in there. But what's the beauty of it is because we're so different, sometimes that incredible attention to detail that my wife has in 39 years of marriage, and we've been together probably about 41, 42 years, saves us. Sometimes that bigger picture perspective, but we get them both because together we have both. But if I fight every step of the way with the fact that she doesn't see the things the way I see them and she experiences them different, we don't get to have the beauty of having two different paradigms, two different perspectives. But we learn a lot. And sometimes what helps us in one situation will be her perspective. Sometimes it's mine. Sometimes it's both. So there's more than one valid reality, and each reality is real, and how you experienced it is just as real and important as how your partner did. And wanting to know and understand your partner's perspective as desperately as you want them to know and understand yours is what builds an incredible, loving relationship. So yes, we can improve relationships. We can improve life satisfaction. We can work on all of that. Let's go to the next slide and connecting. So how do we connect? We're all hardwired for connectivity. We talked about how vulnerability is scary. You can't selectively shield. When you numb with whatever, you're numbing creativity and love, just like you're numbing the sadness, hurt, and pain. You can't selectively numb. When you're a workaholic, I've been there, done that, understand it perfectly, and you're throwing yourself too much into your work, your life suffers. Who and what is it all for then? All the things that I've accomplished would mean nothing without my amazing wife who supported me and lived the good, the bad, and ugly of it with me. She definitely deserved a PhD when I was finished with my doctoral degree because that was really challenging and she lived it with me. She should have got one too, for sure. But vulnerability is the only path to connectedness, love, and creativity. And I know it's scary because sometimes it hurts to open yourself and step out and be in fully present and authentic. Next slide. Okay, so what are your goals? This is what's most important and what I want you to think about. What are your goals with intimacy? If intimacy is communication on all levels and connectedness, what are your goals with intimacy and sex? If sex is about pleasure, if you're not trying to procreate anymore, it's about pleasure and connectedness, there's lots of ways to get there. We talked about it. You're not going to get better in talking about or communicating about sex if you don't start communicating and talking about sex. Trust me, it's not going to happen because the more you avoid it, the worse you're going to be at it. The more you work on it, and not in the middle of sex. That's when you don't want to stop and say, oh, I didn't like that. That didn't go. It's outside of the bedroom, that pillow talk when you can talk about it and say, hey, babe, let's talk a little bit about our fantasies. Let's talk about what we both need and want. I so desperately want to satisfy you. What is it that really turns you on? Things like that, those conversations, not right in the bedroom during sex, and the more you do it, the better you get at it. Let's go to the next slide. Okay, so we've got therapies, and that's what these next slides are. We have pills. We have sildenafil, vardenafil. Levitra is no longer available from the company, but vardenafil, the generic version, is still available. Tadalafil, Cialis. So both generic and trade name. Same with sildenafil Viagra. Same with Avanafil Stendra. The most important thing is these drugs are metabolized in your body, so you need to take them carefully. Sildenafil especially needs to be taken on an empty stomach. The first three will get in about 30 to 60 minutes, but they won't peak for an hour. So you got to take them at least an hour to an hour and a half ahead of time. The window of opportunity, and you need to see because your body's unique and miraculous, and how does it work in your body, is usually about 1 hour to about 3 hours after you take that dose. You'll get the peak effect from the medication in your bloodstream. Remember, these medications, they work in a tangential way. So in other words, they inhibit an enzyme that inhibits the chemicals in your penis that make you hard. That's a roundabout way. And so when you get excited, and only when you get excited, you will get harder. You won't walk around with erections because, again, the way this works is There's more chemicals in your penis that when you get excited and those chemicals are activated, you should get harder. They work in about 70% of patients. They do require some timing. Now, Avanafil gets in twice as fast. That one will start getting in like 15 to 20 minutes and peak in about 30 to 40 minutes. But ultimately, nothing ever worked any better than sildenafil. That's why it's still the #1 most popular. #2 is tadalafil because it lingers longer. It just hangs out longer in the body. But both of those get in to peak effect in about an hour, and their best effect is over in about 2 to 3 hours, but they still have some effect, with sildenafil being out of your body in about 8 to 12 hours and tadalafil being out of your body in about 30 to 36 hours, 3 times longer. But you won't get the same effect 24 hours after tadalafil that you did 1.5 hours later during its peak. And Avanafil will be out of your body really quickly. There's lots of little nuances to these. I can answer questions about them, but let's go on to the other treatments in the next slide. Here's the vacuum device. The best thing about the vacuum device, and I don't try to talk you in or out of any of this, they all have good and bad. And they all have positives and negatives. But really, the only thing I try to do with my patients is give you the information you need to make your own informed choice. The best thing about this is that it works in a good 90% of men. It's physics. When you put your penis inside this cylinder and you start to pump, it forces more blood in your semi-erect penis, if you get semi-erections, or your flaccid penis, and forces more blood in and makes you harder. Once it's hard enough, here's the cylinder, here's the pump, you transfer the ring off the edge of the device to the base of your penis so you can get your penis out of the device and into your partner. Now, here's the thing. So here it has rings and it has a pump. The pump brings more blood in and makes you harder. If you get partial erections, anything, even some fullness or anything, don't start with the flaccid penis because that partial erection already has blood down to the tip and will receive more blood all the way down to the tip easily and more readily if you start with anything you can start with. So think sexual thoughts, use that lubricant to get your penis started, and that jump start is how hard can you get from the pill or from whatever before you put in the pump. The more you start with, the easier it is to pump up. The more flaccid you start with, the more practice and patience and, trust me, many release and readjustments to get to the right place. Sometimes 30 or 40 hit the release and readjust it in there. I actually did a video with Kathy Marchese, who did it with me, on tips on the vacuum pump, and you can watch that video on my podcast, and it goes over in great detail. But you really want to work with a professional to learn how to use this. And then once you learn how to use it, practice and patience. But once you got it, it works in a good 90% of men. I very rarely met a man who, once we worked with it and they knew how to use it properly, they practiced with it every day and were patient, that couldn't get it to function. Now, you still may hate it because it's messy. It requires lubricant. You have to wear a ring during sex. There's lots of little nuances that you may hate about it. And you don't ever have to use it if you don't want to. And if you hate it, don't use it. But the bottom line is, the good side is that it does work. It requires a lot of practice and patience. It's messy, it's cumbersome, it's weird. The penis feels a little strange with the band on and everything. There's lots of good and bad with all these things. And so we can talk more if you have questions. But let's go on to the next treatment. And that is injections. This may sound horrible to you, but literally men learn to do self-injections directly into the penis, which causes direct smooth muscle relaxation, blood engorges and fills the penis, and you get hard. So those injections work in about 70 to 85% of patients, but they do have side effects. As we get more invasive, there's more side effects that can occur. The most common side effect is as the drug kicks in, you may get an achy pain in the penis. That's the most common thing. About a third of men get that. Bleeding and bruising. You're sticking a needle in a very blood dense area. So that can cause bleeding and bruising, but it can also cause some more serious side effects like priapism, an erection that won't go away, or permanent scarring in your penis. There are things to think about. No treatment is for everybody. There's good and bad with everything, but as you get more invasive, there's more risks and and side effects to think about. So as we move from non-invasive, like the vacuum pump, the pills, fairly non-invasive, to more invasive, the shots, more side effects, more risks, to most invasive, the penile implant surgery. Next slide. And oh, one more thing. This is a new product that's out there. It's the first topical over-the-counter topical gel. With 250 men with erectile dysfunction for greater than 3 months. Now, this is a modest improvement, but 60% had erections within 10 minutes, and they, with their IIEF, which is a score that helps us see, can they have sex? Are they able to use it? About half to 60% were able to. It's a novel drug that causes an initial cooling, which brings more blood into the penis and makes you hard. It is not the be all end all, but we're always excited to have another product out there. This is over the counter, so you don't have to have a prescription. If you have pretty severe erectile dysfunction, it is not been tested or shown to be helpful in men like that. But in these men, they did find that about half to 60% of them had a response with the Roxin, which is a topical gel that you work into the head of the penis. And you can look that up and learn more about it. Let's go to the next one. And that is the penile implant surgery, which I've talked a little bit about. Now, this is permanent. So the most important thing you need to know, once they put all this hardware in, just like if they replaced your knee or hip, you will never be the same again. And you can't expect to go back to any other treatments because your penis will be permanently changed by this procedure. But having said that, 80 to 88% of the men and only about 1 to 2% of men with erectile dysfunction will go on to do something as invasive as a penile implant surgery, but 80 to 80% of them and their partners are happy with it. Again, my job is not to persuade or dissuade you, but just to let you know good, bad, and ugly of each thing. And as we get more invasive, less and less people will do these things. Some people will just opt for non-penetrative sex or outer course because their partner or their partner may have vaginal atrophy or dryness and not be able to have intercourse either. So non-penetrative sex and oral, manual, or vibratory stimulation, rubbing genitals together, is a perfectly fine option as well as these other treatments. So we've talked about them, and let's go to the next couple slides, finish up, and I'd like to get your questions. Now, there may be some women out there, and we just talked about vaginal dryness and atrophy. If you live long enough, almost all women after menopause will have vaginal dryness and atrophy and need to work with their doctor on that. The pill, these go in the vagina, the local tablet, the local cream, and the local ring all work equally well. Work with your provider to address these issues. These are hormonal local therapies that have very little systemic absorption, but they estrogenize the area down there that so desperately needs it to help with the dryness and the shrinkage that can occur after menopause. I can answer more questions, but I just wanted to hit on a few things for partners today as well. Let's go to the next one. And so then there are non-hormonal things like Neogen, which is a vulvar soothing cream. There's also hyaluronic acid. People use that on their face as a moisturizer. It brings moisture forward and it can be really helpful. And so vitamin E, there's some vaginal suppository. Replens has been around forever. It has research to support it. It's a vaginal moisturizer. Nueve was designed by a OB-GYN, an Asian OB-GYN. So non-hormonal type things can be moisturizers for these problems as well. But I will tell you, mostly nothing works quite as well for some people, not all, as those hormonal things that were on the last slide. But we have all kinds of options, and that's the good news about it. Let's go to the next slide. And we also have desire disorders, and so we want to rule out underlying causes. So this can be a hormone problem, but there's so sometimes it can be a hormonal problem, but it can also be just a lack of sexual desire. And we have lots of different things we can do. Reading erotica, doing some simmering, kissing and touching, or just thinking about sex. We teach people play and love play. That came from Masters and Johnson. That's called sensate focus. Again, I can answer more questions, but let's go to our last couple slides, and then we have just a few minutes. There's my resources. Dr. Jeff Sex Talk is my podcast every week on Tuesdays at 7. You can see us live, or you can watch the library absolutely free on your favorite media or on the website. So all that is there. There's some other resources there because I wanted you to have other resources. I wrote a book for patients that can be downloaded for free at drjeffalbaugh.com. You can buy the book, but you can also just download it for free because I had very generous patients that gave to that effort. And because of them, I'm able to offer it for free. You can download it. But the American Cancer Society, Sexual Health Matters, lots of good resources. But lastly, I just want to remind you that sexual dysfunction is common after prostate cancer. Sex and intimacy issues can be addressed successfully. Communication is essential, but if you don't practice it, it's not going to get any easier. So talking about it outside of the bedroom can be a really important thing, or pillow talk, but not during sex. It is so possible to have a fulfilling, wonderful sex life after prostate cancer diagnosis and treatment. And I am more than happy to answer your questions. And I think we have several minutes to do that. And I will do that now. Terry, what do you got for me?
Well, thanks so much, Jeff. I always love your presentations and I learn a lot myself too, which is pretty fun. So let's
Good.
start. We've got quite a few questions. So let's see what we can get through. So this is interesting to me. And have you heard of, what are your thoughts on sensate focus for intimacy? Have you heard
So
about that?
yes, and that was in my last couple slides about the non-hormonal treatments for desire, I talked about Sensate Focus. Sensate Focus is planned love play. It was designed by Masters and Johnson, and so it's setting aside time, committing to time. Sometimes it's a couple times a week, sometimes it's once a week or twice a month, but committing to, we will spend this much time working on love play. Sometimes it involves taking things off the table. There's 4 different levels. The first level involves kissing and touching, but no breast, chest, or genitals. The second level involves chest and breasts, but not genitals. The third level involves genitals, and the fourth level involves anything goes, penetration or anything. But sometimes taking penetration or intercourse off the table removes some of the scariness. It removes some of the performance anxiety. And it also removes, we don't have to have a hard penis to do any of that. So oftentimes we'll say, let's take intercourse off the table and work on just having pleasure and setting aside time, sensate focus, weekly or a couple times a week or a couple times a month to work on love play. And you can look it up and learn about it, but I do it with patients all the time. It's a wonderful way to approach sex. Sometimes people haven't been sexual in so long, Terry. We just have to start over, like from the very beginning. Let's start with kissing and touching and leave the breast. We go right to, okay, I got to go to the genitals. That's what it's all about. And no, it doesn't have to be. Starting over, finding other places. Oh my gosh, the back of my neck is really sensitive. I never knew that until I explored. That's what Sensate Focus is about.
I love that. Okay, and we hear this a lot. What about leaking of urine? Is there anything you can do with that leaking of urine when you orgasm?
Yes, that can be a little tricky. And sometimes even the ring from the vacuum device or a tension loop around the base of the penis will help minimize that. Of course, and probably you've already thought of this, but empty your bladder right before sex. That is one thing that can help. And then sometimes having a tension loop around the base of the penis or somewhere can help as well. Remember, urine, if it ends up somewhere in your partner or on your partner, will not hurt that partner. It typically will not cause problems or difficulties. It can, but it usually won't. You could also, if you're hard enough, throw a condom over the penis to catch the urine in the condom as well if you're concerned about it. Some people who leak don't worry about it. You know, you just clean up, you have things on hand, you deal with it that way. Empty your bladder beforehand, try some of those techniques. It can be a frustrating and challenging problem. I totally understand that. None of us want that leakage, especially during that wonderful moment of orgasm, but sometimes it does happen. And those are some ways you could possibly remediate it.
That's great. Thanks, Jeff. Okay, let's see what else we've got. This is also from the folks in the that are looking on. How long after radiation therapy is it safe to resume sexual activity? In other words, how long should I wait?
So a couple things I would say. Towards the end or middle of radiation therapy, you may want to start just regular stimulation of the penis to get blood moving there. We're not talking about you're trying to orgasm, you're trying to climax, because once you orgasm or climax, it won't move anymore. So that's not anything of what we're talking about. We're talking about just sexual thoughts or tactile stimulation on the penis, or even better, both, to get some blood moving in your penis and get regular erections. Those erections aren't going to hurt anything as you're finishing up. And if you're tolerating that fine as you're going through your radiation therapy, after you finish and the cumulative effect is built up, taking your pills regularly to promote erections, because we want to be proactive about erections as you're doing and completing your radiation therapy, so that then when the cumulative effect happens and those nerves are affected, because when they do surgery, they pull the nerves off. When they do radiation, they're right there, they get radiated, and that causes damage to the nerves that go from the peripheral nerves that are going from your brain down to your penis, off your autonomic nervous system spinal cord. Those nerves are traumatized and they stop working right. And so even before that happens, start encouraging erections. Maybe if you take pills or you're comfortable with the pills, or regular stimulation, just getting the penis moving, not trying to climax. Once it moves, however much it moves, leave it alone, let it settle down, but just encouraging blood flow. But most people don't have restrictions. Now, it depends. If you did seed implants, you have some radioactivity going on, and you may have some restrictions about being intimate with your partner. But other than that, check with your doctor. But individually, people are sexually active sometimes during and after radiation therapy. Check with your particular clinician on their guidelines of what they want you to do and what's okay. But certainly work on those on your own, on those regular erections and blood flow down to your penis to keep function going.
Thanks, Jeff. Now, we've only got time for one more and we've only got a few minutes, but this is a really good question. Um, I know that some of the ED tools recommended are available to purchase like on sites like Amazon, penile ring pumps. So believe it or not, Amazon's got all of that now. So are these just as effective, or should you really get those types of devices from your physician?
So you can get a good medical grade pump over the counter. There are lots of good brands out there, you will find. I have used Erectgate, I've used Postovac, I've used there's Encore. There are several brands that are medical grade. I like the medical grade ones because they've been tested and FDA approved, but you can get those on Amazon. And that's what I would recommend. You do. I think consulting with somebody is essential for success with the vacuum device. So I think having guidance can be really helpful. And you don't have to pay a lot. Some of those devices can be a fraction of the cost of others. You could pay sometimes, one time they had them on sale on Amazon. One of the pumps I used all the time, it was like $30. I was like, wow. But often you can get them for $100 versus $400 or $500 that it can cost sometimes for other pumps. And some of them are excellent, perfectly good medical grade pumps. So I always just look for medical grade quality pumps and then go from there. But you do need the pointers. And the guidance from a professional can be really, really helpful, that one-on-one training. And then with the vacuum pump, practice and patience is everything when it comes to the pump. But I would like to do a little centering exercise to finish us out so we can ground ourselves. I know we're at the end of the day, so I know we're at our time, but if you don't mind, I'd like to just talk you through again, because, oh my gosh, we inundated you with lots of different information, probably overwhelmed you a little bit, but I hope it was helpful. So let's get grounded again. Let's go back to, it was a lot to digest today. So let's just ensure you are once again seated comfortably. Get comfortable in your chair with your feet flat on the ground. Gently close your eyes if you feel comfortable. Begin by taking a slow, deep breath, just like we did at the beginning, through your nose, allowing your abdomen to rise, and then exhale steadily through your mouth. Continue this breathing pattern, focusing on the rhythm of your breath. Breathing's powerful. Bring your attention to your body as you continue that breathing pattern, starting from your head, gradually moving down to your toes. Notice any areas of tension or discomfort. Don't judge them. And as you exhale, imagine releasing that tension as you exhale. Just melt into the chair. Feel a sense of relaxation spreading throughout your body. Visualize yourself standing on a warm, solid ground. Imagine roots extending from the soles of your feet deep into the earth, anchoring you firmly. Feel the stability and support from the ground, giving you a sense of strength and balance. Your body is amazing and miraculous. You are not defined by prostate cancer or any other disease. Repeat to yourself, I have faced this day with strength and courage. I am deserving of love and belonging. I am enough. I am more than enough. Take 2 more deep breaths. Inhaling deeply through your nose. Exhaling through your mouth. Inhaling deeply. And with each exhale, feel a deeper sense of relaxation and contentment. Begin to bring your awareness back to your surroundings. Gently wiggle your fingers, your toes. When you're ready, slowly open your eyes, taking a few moments to adjust and reorient yourself to the presentation and where you are. Carry those affirmations with you because you have the most miraculous body. You are not prostate cancer. You are so much more than that. And thank you for joining me today.
Woo! I felt great. Thanks.
Me too. Me too.
Oh, thank you so much. We're so glad you can join us. I always love to hang out with you, Jeff.